You may believe that sleeping through the night is the safest time for your body. But the truth is that for many seniors, the hours between midnight and dawn can be the most dangerous. Research shows that people with obstructive sleep apnea face a much higher risk of sudden cardiac death while asleep, at a time when most of the population is at its lowest risk. Breathing pauses, drops in oxygen, and surges of stress hormones quietly attack the heart and brain. In this video, I will reveal 7 dangers you must never ignore and the safer choices you can make to protect your life. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you find this helpful, type 1 in the comments. If not, type 0 so I know how to make better content for you. Part 1. Why night hours become deadly with obstructive sleep apnea. When most people think about sudden cardiac death, they imagine it happening during the day, perhaps in the morning hours when stress, activity, and blood pressure naturally rise. For the general population, that is true. Studies confirm that the risk of sudden cardiac death is lowest between midnight and 6 in the morning. Yet for people with obstructive sleep apnea, the pattern is strikingly reversed. Research from the New England Journal of Medicine shows that nearly half of all sudden cardiac deaths in patients with sleep apnea occur during these quiet hours of the night. This means the very time you believe your body is recovering may actually be the moment of greatest danger. Why does this happen? Obstructive sleep apnea causes repeated pauses in breathing while you sleep. Each pause leads to a drop in oxygen, a rise in carbon dioxide, and an urgent alarm within your nervous system. Your body responds by releasing stress hormones, raising blood pressure, and forcing the heart to beat harder. Imagine this cycle repeating dozens or even hundreds of times every night over years. These nightly assaults leave the heart muscles scarred, the blood vessels stiffened, and the electrical system of the heart unstable. Instead of resting peacefully, your body is fighting for air in the dark. What makes it especially dangerous is that these episodes often go unnoticed. Many seniors never recall waking or gasping for breath, yet their bodies are subjected to constant strain. Family members may notice loud snoring, pauses in breathing, or restless sleep. But the person affected may insist they slept through the night. The reality is that inside their body, oxygen levels may have dropped to critically low points, sometimes below levels seen in serious lung disease. During this time, the heart faces a perfect storm. Low oxygen makes the muscle irritable. High stress hormones make the rhythm unstable, and sudden surges in blood pressure strain the arteries. Together, these factors explain why death that rarely happens at night in the general population strikes so often in patients with sleep apnea. You may think feeling tired during the day or waking with a dry mouth is harmless, but these are silent warning signs that the body is not getting the restorative sleep it needs. Over time, the damage accumulates, leading not only to sudden death, but also to strokes, heart failure, and memory decline. The important lesson is that night hours are not always safe hours. If you or a loved one has loud snoring, frequent nighttime awakenings, or unexplained daytime fatigue, you must take these symptoms seriously. They are not simply part of aging. They are potential signs of a condition that triples your risk of dying suddenly in the night. If this surprised you, wait until you hear how drops in oxygen and surges of adrenaline can directly trigger fatal arrhythmias in Part 2. Part 2. How oxygen drops and adrenal surges trigger fatal arrhythmias. One of the most dangerous effects of obstructive sleep apnea is the repeated drop in oxygen that occurs each time the airway collapses during sleep. These episodes can last 10, 20, or even 30 seconds. And in severe cases, they may happen hundreds of times each night. Every pause deprives the heart and brain of the oxygen they need, forcing the body into a cycle of crisis and recovery. When oxygen falls, sensors in the body trigger a surge of adrenaline and other stress hormones in an effort to restart breathing. These hormonal surges make the heart beat faster and harder, raise blood pressure sharply, and disturb the delicate balance of the heart's electrical system. For a younger person, this stress may be tolerated, but for seniors with stiff arteries or weakened heart muscle, the strain can be overwhelming. The heart rhythm may become unstable, leading to what doctors call arrhythmias, irregular patterns that can cause the heart to flutter, quiver, or stop altogether. Studies have shown that patients with obstructive sleep apnea have a significantly higher rate of atrial fibrillation, ventricular tachycardia, and even sudden cardiac arrest compared with those without sleep apnea. In fact, research published in leading cardiology journals confirms that the severity of oxygen drops is directly linked to the risk of deadly arrhythmias. Imagine trying to run an engine without enough fuel, then flooding it with bursts of fuel again and again. Over time, the engine begins to sputter, misfire, and eventually fail. That is exactly what happens to the human heart exposed to years of oxygen deprivation, followed by adrenaline surges. Seniors may notice warning signs such as a racing heart at night, waking suddenly with palpitations, or morning headaches caused by overnight oxygen loss. Some describe waking drenched in sweat or with a feeling of panic, unaware that their body has been fighting for air. Others may never feel a thing until one night the imbalance becomes too great and the heart slips into a fatal rhythm without warning. Even continuous minor arrhythmias can damage the heart muscle over time, leading to heart failure and chronic fatigue. Doctors now recognize sleep apnea as one of the most underestimated causes of cardiovascular disease, not only because of its direct effects, but also because so many cases remain undiagnosed. Millions of seniors live with the condition but have never been tested, attributing their symptoms to aging or stress. This lack of awareness leaves them exposed to a nightly threat that quietly erodes their health. The message is clear: oxygen drops and adrenaline surges during sleep are not harmless. They are red alerts from your body that must be taken seriously. If this information startled you, wait until you hear the red flags you may feel after waking at night, and what they truly mean in Part 3. Part 3. Red flags you feel after waking at night and what they mean. Many seniors dismiss the small discomforts they feel at night as ordinary signs of aging. But in truth, these red flags often reveal serious problems hidden beneath the surface. If you have ever woken with a pounding heart, gasped for air, or felt dizzy and weak after standing, you may have experienced the warning signs of obstructive sleep apnea and its impact on your circulation. These signals should never be ignored. One of the most common red flags is waking with a dry mouth or sore throat. This happens because the airway repeatedly collapses, forcing you to breathe through the mouth, leaving tissues parched. While it may seem harmless, it is a marker of disrupted sleep and oxygen loss. Another frequent sign is morning headache. These headaches are not like those from dehydration or tension. They are caused by the buildup of carbon dioxide during repeated apneas. Carbon dioxide dilates blood vessels in the brain, creating pressure and discomfort that often fades after waking, but points to deeper harm occurring night after night. Daytime fatigue is also a powerful warning. Seniors often assume that feeling tired in the afternoon is normal. But persistent exhaustion means your sleep was fragmented and your brain never reached the restorative stages it needed. Over time, this constant fatigue weakens memory, slows reaction time, and increases the risk of accidents and falls. A more serious red flag is waking with chest pain or palpitations. This can feel like fluttering, pounding, or skipped beats. Each event signals that your heart rhythm has been disturbed, often by the adrenaline surges and oxygen drops we discussed earlier. Ignoring this symptom could mean overlooking the early stages of arrhythmia or even impending cardiac arrest. Families may notice clues too. Loud snoring that pauses suddenly, followed by gasping or choking, is a hallmark of sleep apnea. Restless movements in bed, night sweats, or frequent trips to the bathroom can also be indirect signs that the body is under stress while trying to sleep. Some seniors even report waking in the night confused or disoriented, a sign that the brain is not receiving adequate oxygen. These warnings are not to be taken lightly. Studies show that seniors who experience nocturnal dizziness or fainting have a significantly higher risk of stroke and sudden death. Every one of these red flags is like a flashing signal on the dashboard of your body, telling you that urgent attention is needed. The tragedy is that so many people ignore these warnings until a major event strikes. The good news is that once you recognize these signs, you can act before it is too late. Screening for sleep apnea. Discussing symptoms with your doctor and making simple changes at night can dramatically reduce risk. If this surprised you, wait until you learn about a safe and practical 3-step routine that takes only 2 minutes and can protect you every night in Part 4. Part 4. The 3-step 2-minute routine to rise safely from bed. Now that you understand the dangers of ignoring the red flags of sleep apnea and sudden nighttime strain, let us turn to a practical solution that every senior can use starting tonight. This is a simple 3-step routine that takes only 2 minutes yet can make the difference between safety and tragedy. The first step is to remain lying on your side, preferably the left side, for about 1 minute after waking. During this time, take slow, deep breaths to fill your lungs with oxygen. This position eases pressure on the heart and allows your circulation to stabilize. Deep breathing signals your nervous system to shift from the low activity of sleep toward wakefulness in a calm, gradual manner. Patients who follow this step often report feeling more alert and less rushed, as if their body had time to catch up with their mind. The second step is to slowly push yourself into a seated position on the bed and remain there for about 30 seconds. Keep your feet still resting on the mattress and your hands on your thighs. In this position, your blood begins to redistribute under the influence of gravity. But your heart and vessels are given enough time to respond. This prevents the sudden blood pressure drop that often causes dizziness, fainting, or even dangerous arrhythmias. Think of it as letting a car engine idle before driving off, allowing it to warm and prepare before being placed under strain. Seniors who adopt this step consistently notice fewer dizzy spells and greater confidence when getting up at night. The third step is to move your legs gently over the side of the bed and let your feet touch the floor, remaining seated for another 30 seconds before standing fully. This step activates the muscles in your legs, which act like pumps to send blood back toward the heart and brain. You can wiggle your toes, rotate your ankles, or lightly flex your calves to encourage circulation. Only when you feel steady should you rise to a full standing position. By now, your brain has received a fresh supply of oxygen. Your heart rhythm is stable, and your balance is secure. These 3 simple steps may sound minor, but their protective power is immense. Studies in geriatric medicine confirm that seniors who rise gradually experience far fewer nighttime falls, fainting episodes, and cardiac events compared with those who rise abruptly. Families often share how a loved one who once felt fragile at night regained independence and peace of mind simply by practicing this 2-minute routine. It requires no medication, no equipment, and no cost. Only discipline and awareness. If you think 2 minutes is too long to spare, remember that a fall, a fainting spell, or a sudden collapse can steal years of independence in an instant. This short investment of time pays back with safety and health every night. And while this routine is powerful, it is only part of the bigger picture. In Part 5, we will look at the medical tests and treatments that can further protect your heart and brain during sleep. Part 5. Testing and treatment that protect the heart and brain at night. Understanding the dangers of obstructive sleep apnea is important, but taking action is what truly saves lives. The first step is proper testing. Many seniors live with sleep apnea for years without knowing it because the symptoms are silent or blamed on aging. The gold standard for diagnosis is a sleep study, also called polysomnography. In this test, sensors measure your breathing, oxygen levels, heart rhythm, and brain activity while you sleep. It may sound intimidating, but it is painless and provides vital information. For those unable to attend a sleep lab, home sleep tests are now available and can still capture essential data. These tests reveal how often your breathing stops and how low your oxygen drops, giving doctors a clear picture of your risk. Once diagnosed, treatment options are available that can dramatically reduce nighttime danger. The most widely studied and effective treatment is continuous positive airway pressure, or CPAP. This device delivers gentle air through a mask to keep your airway open during sleep. Studies show that consistent use of CPAP not only reduces snoring and improves energy, but also lowers blood pressure, stabilizes heart rhythm, and decreases the risk of sudden cardiac death. Some patients worry about discomfort, but modern machines are quieter and masks more comfortable than ever before. For those who cannot tolerate CPAP, alternatives exist. Oral appliances fitted by dental specialists can reposition the jaw and tongue to prevent airway collapse. In certain cases, surgical procedures may reduce tissue blockage or implant small devices that stimulate airway muscles. Weight management, avoiding alcohol before bed, and sleeping on your side are lifestyle changes that further support treatment. Doctors may also check for related conditions such as high blood pressure, diabetes, or atrial fibrillation, since sleep apnea often worsens these problems. Treating them together provides stronger protection for the heart and brain. It is important to remember that untreated sleep apnea is not simply about poor sleep. It is a cardiovascular disease risk factor. Just like smoking or high cholesterol, ignoring it leaves you vulnerable to stroke, memory decline, and sudden death. Taking it seriously puts you back in control. Families play a key role as well. If a loved one snores loudly, pauses in breathing, or shows signs of fatigue, encourage them to be tested. Many seniors resist because they feel embarrassed or believe nothing can be done. But education and support often change minds. The moment treatment begins, improvements are often felt within days or weeks. Patients report clearer thinking, more energy, and fewer nighttime awakenings. The heart benefits almost immediately from improved oxygen and reduced strain. Remember, testing and treatment are not signs of weakness. They are acts of strength and self-preservation. If you have been putting off a sleep evaluation, consider this your wake-up call. Protect your heart, protect your brain, and protect your independence. If this gave you hope, wait until you hear about the daily habits that can make your nights safer and your mornings healthier in Part 6. Part 6. Habits that make nights dangerous and safer choices you can make. Even with testing and treatment, your daily habits play a powerful role in shaping how safe your nights are. Certain routines increase the risk of obstructive sleep apnea and sudden cardiac events, while others support healing and protection. The first harmful habit is drinking alcohol before bed. Alcohol relaxes the muscles of the throat, making airway collapse more likely and worsening apnea episodes. Seniors who enjoy a glass of wine or spirits in the evening may not realize that each drink adds to nighttime oxygen drops. A safer choice is to avoid alcohol at least 3 hours before sleeping and replace it with calming alternatives like warm herbal tea or water. Another common danger is the use of sedative medications or over-the-counter sleep aids without medical supervision. These drugs also relax the airway, prolong apnea episodes, and blunt the body's ability to wake when oxygen falls. If you rely on such medications, discuss safer options with your doctor, including non-drug strategies like relaxation techniques, regular sleep schedules, or supervised therapies. Excess weight is another critical factor. Fatty tissue around the neck narrows the airway and makes collapse more frequent. Even modest weight loss of 5 or 10% can dramatically reduce apnea severity. Adding regular physical activity, such as daily walking, not only helps control weight, but also strengthens the cardiovascular system and lowers blood pressure, further protecting the heart and brain. Smoking is another silent risk. Tobacco irritates and inflames the airway, worsening snoring and apnea. Quitting smoking not only reduces these problems, but also improves lung capacity and circulation. Seniors who stop smoking, even after decades, see measurable improvements in sleep quality within weeks. Poor sleep hygiene also contributes. Staying up late, heavy meals before bed, or irregular schedules confuse the body's natural rhythm. A consistent bedtime routine, a quiet, dark environment, and avoidance of screens in the hour before bed help the brain enter restorative sleep more easily. Small details matter too. Sleeping position influences apnea severity. Lying flat on the back makes airway collapse more likely, while sleeping on the side reduces episodes. Some patients use body pillows or positional therapy devices to encourage side sleeping and report dramatic improvements. Hydration also plays a role. Dehydration thickens mucus in the throat and nose, increasing snoring and obstruction. Seniors should aim for balanced fluid intake through the day, reducing only close to bedtime to avoid frequent bathroom trips. Finally, untreated medical conditions like nasal congestion, thyroid disorders, or acid reflux can worsen nighttime breathing. Managing these conditions with proper care supports overall airway health. The message is clear. Harmful habits accumulate to magnify nighttime danger, while safer choices build protection. Each positive change, no matter how small, reduces strain on the heart and brain, and when combined with the 3-step routine and medical treatment, they form a strong shield against sudden death in the night. If you think lifestyle changes cannot make a big difference, wait until you hear the simple safety checklist and emergency steps every senior should know in Part 7. Part 7. your nighttime safety checklist, and when to seek emergency care. Knowing the risks of obstructive sleep apnea and sudden cardiac events is only useful if you translate that knowledge into action. To help you and your loved ones feel safer each night, I want to give you a simple checklist that every senior can follow before going to bed. The first item is to create a safe bedroom environment. Make sure there is a clear path to the bathroom without clutter, loose rugs, or furniture that could cause a fall. Install night lights along the way so you never have to walk in darkness. A fall at night can be just as deadly as a heart event if it results in fractures or head injuries. The second item is to keep water and essential medications within reach at the bedside. Waking up gasping, coughing, or with chest discomfort may be frightening, and having quick access to what you need can make a difference. Third, check that your CPAP machine or oral appliance is in proper working order if prescribed. Consistent use of these treatments dramatically lowers risk, but only if they are applied every night. Fourth, practice the 3-step routine we discussed earlier. Lying on your side and breathing deeply, sitting up slowly, and resting your feet on the floor before standing are essential to prevent sudden drops in blood pressure. The fifth item is to avoid heavy meals, alcohol, or sedatives within 3 hours of bedtime. These choices not only worsen sleep apnea but also increase strain on your heart and digestion during the night. Another key item on your checklist is to maintain communication. Keep a phone or alert device by your bed in case of emergency. Seniors who live alone should consider a wearable alert system so help can be summoned immediately if collapse or severe symptoms occur. Timing matters when it comes to emergencies. If you wake with crushing chest pain, severe shortness of breath, sudden weakness on one side of the body, slurred speech, or confusion, do not wait to see if it passes. These are signs of heart attack or stroke, and every minute counts. Call emergency services immediately. Do not attempt to walk it off, and do not delay. Loved ones should also be educated to recognize snoring, gasping, or unusual silence during sleep, as these may indicate breathing stoppages that require urgent evaluation. Families who monitor each other in this way often provide the first clue that treatment is needed. Finally, make it a habit to review your health regularly with your doctor. Report any new or worsening symptoms. Ask about testing if you suspect sleep apnea. And do not downplay concerns. Prevention is always stronger than reaction. This checklist may sound simple, but each step is a layer of protection. When combined, they greatly reduce the risk of nighttime tragedy and increase confidence that you can sleep safely. Remember, awareness is power, and preparation is protection. And as we close this discussion, let us reflect together in the conclusion on why it is never too late to protect your heart, your brain, and your life. It is never too late to protect your heart, your brain, and your life. We have now walked together through the hidden dangers of sleep apnea, the deadly risk of sudden cardiac events at night, and the powerful steps you can take to protect yourself. The truth is that many seniors believe that health decline is inevitable, that dizziness, fatigue, or nighttime palpitations are just natural parts of aging. But science has shown us that these are not harmless signs. They are red flags that demand attention. By ignoring them, you allow damage to accumulate quietly until one night it becomes irreversible. By acting on them, you open the door to healing, protection, and independence. Your body, even after decades of strain, still remembers how to repair itself. The heart responds almost immediately when oxygen supply improves. The brain regains clarity when restful sleep is restored. Balance and strength return when circulation is protected. It is never too late to change the outcome of your nights and the quality of your days. Imagine how many tragedies could be prevented if every senior practiced the 3-step routine, avoided dangerous habits, and sought proper testing and treatment. Fewer families would face the shock of losing a loved one suddenly in the night, and more would enjoy years of shared laughter and memories. You have the power to be part of that change. This is not about fear. It is about responsibility and hope. Each small choice matters. Lying on your side before rising, staying active, managing weight, using prescribed therapy, and creating a safe bedroom environment all combine to form a shield against the silent dangers of the night. Do not underestimate the strength of these simple actions. I encourage you to share this knowledge with your family and friends. Someone you love may be living with undiagnosed sleep apnea, and your decision to speak up could save their life. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned from this video and plan to apply in your own life. Let us support each other on this journey towards safer nights and healthier mornings. If you enjoyed this video, type 1 in the comments. And if not, type 0. So I know how to make future content even better for you. Do not forget to like, share, and subscribe so you never miss another health tip designed especially for seniors who want to live longer, stronger, and safer lives. Remember, your nights do not have to be dangerous. Your mornings do not have to be filled with fear. And your future is still full of possibility. Protect your heart, protect your brain, and treasure the gift of life, beginning tonight.